If you're watching this video, you are interested in brain spotting, or you're looking for a brain spotting therapist. At the time of this recording, it is being practiced in over 40 countries with 14,000 brain spotting practitioners or therapists, of which 600 are BIPOC brain spotting therapists. Brain spotting is essentially a brain-body healing modality. By nature, it utilizes intuition, uncertainty, and attunement between client and therapist. Let me show you using a brain model. So here's a brain model. I'm not going to bore you with all the different parts of the brain, but I want to talk about three foundations and how this all ties into brain spotting. So our neocortex is where we rationalize or think. This is things like time and space, location, how to do math. As we get further in, we call this our limbic part of the brain. How we feel. This is our feeling brain. This is how we respond. The deeper part of the brain is what a lot of people call the reptilian brain. This is primal instinctual brain. This is the part of the brain that's highly important. And this is where brain spotting impacts more than traditional talk therapy that usually is focused here. Brain spotting goes all the way here. So let me tell you why this is really important. Well, if you experienced a lowercase t or capital T trauma or distressing event in your life, or multiple events in your life, we know that your amygdala part of your brain is the natural alarm response. It will alert you to disturbing or fearful events in your life. And this is primarily based on your environment. And the bells go off and it starts buzzing. Your amygdala part of the brain is the deepest, primitive, instinctual part of your brain. It lets you know, I want to live, I want to survive. It has no rationality, it has no language. The front part of your brain is the part of the brain that gets activated to think through and make decisions, to observe, to process, to put the brake on things and come up with something that makes sense to what your body is telling you, what your amygdala part of your brain is saying, like, we need to respond right now. And the front part of your brain is having a conversation as fast as possible to make the best decision. So why are these two things linked and why are they important? Well, if you've experienced chronic or a capital T trauma or stressful event in your life, what happens is it gets looped into a frame. I call these frames. It gets stuck. And you're looping and it manifests in your life as symptoms known sometimes commonly as anxiety, irritability, social isolation, angry outbursts, disturbing sleep, strong emotional reactions, even self-sabotaging behaviors, relationship and attachment issues. It makes for a bad combination together when these events are happening and it's being looped and nothing's happening in your environment, yet you're responding in the same survival mechanism. An overreactive amygdala or primitive brain combined with an underactive front lobe is not a great combination. We know that people who have experienced a lowercase t or capital T trauma or distressing event have unwanted feelings that pop up out of nowhere. And they're always on the lookout for threats. And this is related to the hippocampi, the memory part of the brain. The loop, it's replaying over and over and over. It has not completely processed. This is the part of your brain or your computer creative machine that is not rewriting the story. It's utilizing the same storyline, the same song, and it's playing it exactly as it was maybe 5, 10, 15 years ago. Your hippocampus part of the brain, the memory bank, remembers it exactly as it wants to remember it, and it makes sense of it exactly as it wants to make sense of it without any form of language. All this information doesn't get coded correctly. It's just sitting there. And so basically what's happening is that part of that memory bank is trying really hard to make sense of things. So this is what brain spotting does. It passes the front cortex and goes right into the reptilian part of the brain, the part of your brain that's instinctual. It also goes to the part of the brain of the memory, and it is creating new neural pathways. It is creating and rewriting your way of understanding what happened. And I want to share that every person's experience will be different. You might only need 3 brain spotting sessions. Some may need 30, 40, 50. It depends on the complexity of your concern and other concerns that may rise up as a result of brain spotting therapy that you want to continue to work on. So essentially, brain spotting is able to access this part of your limbic system, this part of your midbrain, and it's integrating this still image and is transforming it by creating new neural pathways so that you can release and have a transformative experience, a new way of seeing your past, your present, and even your future. Brain spotting lights up that part of the brain, specifically parts of the brain that's going to help you regulate, that's going to help you realize the core of the presenting issues. Brain spotting is essentially a focused mindfulness therapy using natural instincts, creativity, intuition, spirituality, knowing, for healing recurring suffering in its most present form. My hope is that everyone's able to access and experience brain spotting therapy. I hope this information was helpful to you. For more information on where to locate a brain spotting practitioner or therapist, you can go to brainspotting.com. For more information about me, I'm located in Boston, Massachusetts. You can find me at groundinghearts.com or Psychology Today.